Hi
Hi,
guys! Welcome back to another video. You already know who it is.
It's Ange and it's Nat.
You feel me?
And this week we're going to be talking to you guys about imposter syndrome. So I think a few people have commented about us talking about imposter syndrome in nursing. And we haven't spoken about it because I have no idea what it is.
And before this video, we were like chatting about it just because we were like, wait, what is it? And I have heard it before from my therapist, but not necessarily in nursing. And I'm sure a lot of people also struggle through it too, because I have cousins, family members that actually do struggle with this imposter syndrome as well. So the question is, what is
imposter syndrome?
What is it? What is it? We looked at it. We Googled it. And imposter syndrome is the condition of feeling anxious and not experiencing success internally, despite being high performing in external objective ways. The condition often results in people feeling like a fraud or a phony and doubting their abilities.
Okay. All right.
Right here.
So I don't know, like, have we felt imposter syndrome? Maybe at some point in our lives, in our careers, we have. Like,
I think you have, but not in the career setting. Do you feel like a fake or a phony when you're caring for patients?
No, I don't feel like a fake. I mean, I'm trying to think back of when I first started as a nurse, and I'm thinking like maybe it could have been at that time that it's more possible that could happen. Like you could feel imposter syndrome as a new nurse. And I'm trying to think back. I mean, definitely when you first start, you are anxious. I was anxious.
Yeah.
I felt like, wow, like I'm gonna be in charge of or having to care for 5 patients. Like I'm their nurse. Like even writing my name on the wall, I'm like I'm their nurse. Like that's me. Like do I even am I good enough for this? I guess that could
that's
be
what it is.
Imposter syndrome. But I mean, I do always think, I am a nurse. I went to school for it. I got the proper amount of training. I may not know everything, but, I mean, I'm just going to ask questions.
Yeah.
You know what I mean? But I did feel anxious, especially in the beginning, because I just felt like, wow, I felt like a lot of responsibility on my shoulder, and I felt like I didn't know what to do.
Yeah.
I will say later on in my career, the only times that I felt that anxiety was when something very, very critical would happen to my patient, and RRT would come, or maybe a doctor would come and they were asking me a lot of questions, and I'm like, I don't have all those answers. And then I would feel inadequate because I'm like, should I know every single thing about my patient?
It's so funny that you say that, because for me, I definitely felt imposter syndrome for sure. And when you're saying that, it reminded me of a time when RRT, a rapid response, if you guys don't know what that is, they came to the floor and they asked about the patient, like, oh, so why, what's the history of the patient? And I'm like, I don't know. But in all reality, I did know. It's just in my head, I automatically felt that I was not inadequate, or I wasn't capable of telling them what was going on. So I shut down, and I'm like, yeah, I don't know. How am I supposed to know? I don't know, because I feel like a fake. I feel like a phony.
Yeah, I guess, okay, so if you put it that way, then I have felt that. I wouldn't say that I feel that in my career in general, but in instances I have felt that. Because I did know a lot of times, and again, most of the time it was during those instances. So RRT, if you guys don't know, as a nurse, when you call RRT, depending on what hospital you work in, they come. It's up to the nurse to call RRT. You can call RRT. You don't need the doctor's.
You don't need a doctor's order or
nothing.
Input. Yeah.
Yeah. So a lot of times when we would call RRT, they would arrive before, and then you call the medical doctor to come as well, obviously. But we would arrive before them. So RRT would come and question us a whole bunch of stuff. And to be honest, some of the things they questioned me and I didn't know what to answer. Some of them I knew, some of them I didn't know, because especially as a med-surg nurse, you have so many patients. How could you really remember
everything?
No, that's why you write it down. Now, if you're trying to ask maybe an ICU nurse, where they only have maybe 1 patient, 2 patients, that will make sense that they know a lot more.
Yeah, that's true.
About their patient.
Because they have I mean, you know, I'm not an ICU nurse, but I'm assuming, this is maybe just an assumption, but I'm assuming ICU nurses have enough time to search up their patients and see what's going on, why they're there, all the labs and all that fun stuff. We don't have the luxury for that. Like, we struggle with the 5 patients to even use the bathroom.
5 if we even have 5. And, you know, not saying that ICU nurses don't have a heart.
No.
They do.
It's more about the knowledge of their patients.
I think it's more also like just remembering and knowing the overall, the overall picture of the patient. Because I know also like the ICU nurses that I know that were also in med-surg, they did also agree that as an ICU nurse, you have a better overall picture of the patient because you also join huddle and the doctors talk with you about the patient's progress, like, and they have like a whole little discussion. As a med-surg nurse, we didn't have that, you know what I mean? And again, we had a lot more patients, so like, a lot of times I'll beat myself up, like, how do you not know? Like, you're supposed to know that the first time they had dialysis was in 2006. Yeah. I'm like, how would I have known that?
Supposed to know?
I don't remember. So I would feel very inadequate and like, wow, like, I'm not a good nurse for not knowing.
Yeah, I mean, also, too, that you say that with the ICU nurses and the med-surg nurses in terms of patient ratios, we had 5 patients that sometimes had similar problems. So it would be like sometimes I would get the question like, oh, so why are they here? Or like, what kind of surgery did they have 2 years ago? And I'm like, oh, wait, was that this patient or was that the other patient? Now I'm confusing the two because I know they both have heart failure, but I'm confused if that one had the surgery 2 years ago and this one didn't. Now I'm completely confused. So you kind of can mix up the information, and that's why, like you said, it's important to write things down. So sometimes in situations like that with RRT, I would have my paper out and they would ask me questions, and I'm like, they're like, oh, so what's the patient's history? Okay, so the patient's history, patient had cancer 2 years, but of course you try to tell them information that is important for the situation, right? So like if the patient had recurrent, like in the past history, had recurrent PEs, and the patient is struggling to breathe and now had an arrest, you kind of may know that there's a chance that the patient might have a PE. You know what I mean? So things like that, you're like, oh, the patient had a PE 2 years ago and this could be it, whatever. You could just tell them the important history. But going back to the imposter syndrome, I just felt like I would shut down because I immediately thought I wasn't capable. And it was even down to the point of when the patient passes, right? Like after the patient died, like I would still be like, wait, did I do something? Because again, I'm thinking I'm not adequate enough. So I'm like, did I do something to the patient that I messed them up? Even though, no, that's not the case. That's not reality. That will happen, But I would always think, was there something that I did that caused the patient to die? And I don't know why. And we've always had these conversations when one of our patients would die. It's like we always blame each other, like ourselves as the nurse. That's not the case.
No, I mean, I think it's just because we were the first ones there. So it's like, what could I have done? But at the end of the day, like, I mean, even doctors have told me, like, nothing could be done. Like, his prognosis wasn't good. And I'm like, really? Like, I didn't know that. Someone could have told me that. I thought he was okay.
He was fine talking all day.
But because of that, sometimes I did feel like less of a nurse, for example, compared to like an ICU nurse. Because I felt like sometimes I would know a little bit less of my patient. Because I'm honestly just trying to get through the day.
Yeah, you're trying to get tasks done.
This done. Like, there's too much.
Send patients this place, get an admission, discharge a patient. Like, there's a lot going on.
Yeah, and honestly, that's the hospital's fault too because of the staffing too. You know, that's another story. Because there were days that I had like a good balance of patients, and I may have had only 3 or 4 patients. And those days I knew a lot more. Like you could talk to me about my patient, and I was clear in the head about what we're doing, what the plan is, and all of that. Of course, like when a patient's more critical, as I got more of like a seasoned nurse, I did focus on like, okay, if this RRT, if this would happen, what am I gonna say? What am I gonna do? Like, I need to have a story. So it's definitely hard. And you know, I think it's just like having patience with yourself and like knowing that every nurse is different. Every nurse has a different role. You can't save a patient. Like you
can't save every single patient.
Exactly.
You're not gonna save every single patient, and that's kind of like what I came into, like first becoming a nurse. I was like, oh, I'm saving everybody. Like nobody can tell me otherwise. I'm saving everybody. But when I got there to the floor, again, like going back to a conversation that we had previously to the recording, you had mentioned like how more about giving each other patience, like giving yourself patience to learn. And as a new nurse, like I felt like I wanted to save everybody, every single person, but I also, as a new nurse, didn't know everything. And I didn't give myself the time to learn that. And I wasn't patient with myself. So then because I wasn't patient with myself, I then told myself, oh yeah, you're a phonie. You can't save everybody. Like you don't even know the information. Like how you, but I also didn't give myself the time to learn the information. So how like it doesn't add up. You know what I mean?
Yeah.
So
and then like I also feel like there were some times during these RRT moments, because again, that's when I feel like I can remember where I mostly felt like in that imposter syndrome thing, where like sometimes I would feel, it would make me feel even better because I actually did know the information. And sometimes even the doctor would be there and they would ask and the doctor wouldn't know, and I'm like, oh snap, I know. You know what I mean? Like, should I say it? And then before in the beginning, I wouldn't say it because I'm like, maybe I should stay quiet. Like, I'm just a nurse. Like, sit down.
Yeah.
Don't say it.
And then when the doctor wouldn't say it right away, and then they would answer, you're like, but that's the answer I was gonna say.
I was gonna say that, and I'm like, Angelica, just
that happens to me all the time.
And then after, sometimes I will say stuff, and I was like, man, I shouldn't have said that. I was stupid. And then I'm like, but you know what? Maybe it could have helped in some way. But
it also could have helped you too, like being comfortable, like saying stuff and being wrong. Like you have to be comfortable with failure, right? Because you're not always gonna be right.
Yeah. And honestly, sometimes I'll just be honest with the doctors. Like I'll be like, honestly, I don't know if this could be. But they told him not to drink water.
And he drank all the water.
And he drank it. I don't know though. I'm just saying.
I don't know. I'm not sure.
I'm just saying. But sometimes it's not good to do that because obviously you're not confident. But it makes me feel better to at least say it. Put it in their head. Maybe they could be like, and a few times it was that. They'll be like, oh, it could be. There's some doctors or some actual even nurse practitioners that are mean.
Yeah.
And they're like, no. And I'm like, okay.
Fine. It was just an idea.
Sorry, I'm even here. Should I leave?
Do you want to take over the patient?
Like, I don't know, but it is hard, especially as a new grad. And then later on, it's just building that confidence. And sometimes it's just faking it till you make it too.
Fake it till you know, people say fake it till you make it, but I don't know how to fake it. I really do not know how to fake it.
Like when you're putting in an IV for the first time, you're not telling the patient this is my first time.
Don't say that.
They're gonna be like, well, have you done this before? You're like, yeah, I've done it a few times.
I've seen it a few times.
Or be like, yeah, a few times. They don't know
what's a few.
You know, if you just like build yourself up, I feel like it gives you more confidence. Or like even like now I'm not saying to lie in terms of like, oh, if a patient asks you something and you could lie and say like, oh yeah, we do it this way, even though you don't know. No, you could just be like, oh, you know what? Like I've done it before, but let me just make sure.
Yeah, that's it.
And make sure, and then you come back with the right answer.
Yeah.
But you know, that worked for me a few times because I'm like, you know what? I don't want to feel like I don't know what I'm doing all the time. Like I'm gonna fake it, but obviously not put my patients in jeopardy.
No, of course not. But if you're trying to put an IV for a patient that needs it, and you're not necessarily seasoned in putting IVs, you could, fib a little.
Be like, yeah, like, I've done it before. Like, yeah, I've been practicing a lot more, which is true.
I'm
not a pro. Yeah. Not a pro. But the thing is, they're never going to let you do, like, a lot of patients are never going to let you do it if you'll be like, this is my first time, actually. And there are a few that are really nice, though.
No, yeah. I think I'm a pretty good patient. I was in the ED before. I mean, this is like a little story time. But there was a new nurse there, and she was trying to put an IV. They tried to put it in my AC. Didn't work. I told her that the vein is pretty small, so I don't think it's gonna get in. I was right. So I said, you know what? Why don't you try here? I usually see a nice big vein here. She got a 20 gauge in there, but it took her some time, and I was totally fine with it because guess what? I was there once too.
Yeah, exactly. And there, you know what? I'm not gonna lie. There are some patients that are like that. They can sense, and they're like, girl, just do it. Just do it.
You got to do it either way, so just try.
Just do it, yeah. And that's really nice. And, that's the only way to learn. A lot of them say it like, well, you got to start somewhere. And I'm like,
Yeah, I think having imposter syndrome is sucks, but a way to kind of overcome it is just giving yourself that time. Mm-hmm. That time to learn, that time to ask questions. But I won't lie, since, I did feel it before, sometimes I would feel like even my questions were dumb.
Yeah, I know.
Like, even the questions, like, you should know this.
Yeah.
Like, you should know this.
Yeah, I know.
But I would ask either way. I'm like, hey, I don't remember, but how do I do this again?
You know what?
Or what does this mean again?
Yeah. sometimes it's better to ask than to lose your license or lose your job.
No, for real.
And we've seen it happen before.
For real.
Not
for
me.
real.
It's not gonna be me. I'm be like, yo, I'm gonna ask all these questions. Again, though, there comes a time that sometimes you're asking questions and you know the answer. You're just not being confident.
That's very true.
And it's very good to, I guess, know the difference. Like, do I really not know this, or am I just not confident enough to go with what I think is?
That's a really good point, friend, because there was a few times that I knew the answer to it, but I wasn't confident enough to say it. Or when I would say it, it would be like let's say, for instance, yeah, this is black. I think this is black, right?
Yeah.
But I knew the answer.
And they're like, yeah, it's black. Yeah. And you're like,
yeah, you see, I knew. I should have been confident, like, oh yeah, this is black. This is black. And it is what it is.
You know,
so what are we doing with the black?
There's people that sometimes be saying stuff so confident and it's the 100% wrong answer. And I'm like...
But they say it with so much confidence.
I believe it. I'm like, but is it though? Maybe it is.
Maybe it is. I gotta search it up now.
You sound very confident right now. I would love to do that. Because it's like, I hate believing in like what you know to be true, and then you don't say it, and then it is true. You're like, wow.
That happens to me all the time. I recently had orientation, and I'm a nurse, and I've been practicing for some time, so there's certain things that I somewhat know.
Yeah.
And I'm there in the orientation, and I'm like thinking about like they're asking questions, and I'm like, damn, I know the answer, but is it that the right answer? Like, should I say it? But more now, I started saying, like, even if it's wrong, I would put on my mic and I would say it, and they would say, oh, good job, Natalie, thank you.
You see? It's just believing in yourself and just...
And it's okay to have the wrong answer. I think that you learn so much more if you put yourself out there being wrong and then reflecting on that. Mm-hmm. Like, oh, I was wrong, but I had the right thinking, but I was wrong.
Yeah, and then it's also just putting in that work afterwards. Because maybe if you're getting the wrong answer, let's say like you're doing cardiology.
Yeah. Maybe
you could go home and brush up on cardiology. Like, hey, that was weak for me, like a weak subject for me.
Yeah.
I can brush up on it, and like, sometimes when I first started, we were in a tele unit, and like 6 months into the job, I was like, I still don't know tele. I don't know how I'm saving these patients. Machine, you better work. You better work, girl. This machine better work, because you better tell me if there's an arrhythmia, because I have no idea.
I know. It's so funny because I don't know the exact arrhythmias, but I know that's not normal.
I'm like,
that looks a little wrong.
So like, yo, you're beating a little weird.
Yeah. So sometimes, like, even though I wasn't confident in what was the arrhythmia, like I couldn't identify it, but I would tell the doctor, like, hey, the rhythm is not normal.
Yeah, like,
can you come take a look?
I'll be honest, like, I don't know if it's sinus block 1, sinus block 2, but it's a sinus block.
It's something weird. So can you come and look?
But you know what it is? And it's knowing that, you know what, like, I don't feel confident in my tele skills, and I'm saying, like, for the first 6 months, I was like, yeah. I know I'm a tele nurse, but I don't feel and guess what I would do? I would ask a nurse. I'll print a strip and be like, hey, I don't know, this looks weird, and they're like, oh, no, the patient was just moving. And I'm like, oh, okay.
Oh. And you learn from that, from asking the question.
Yeah.
I guess, like, having imposter syndrome does suck, because sometimes you don't come out of your comfort zone and, like, ask questions to be uncomfortable. You just have to come out of your comfort zone and just ask questions and learn from that. And I think that's the way you get over imposter syndrome.
Yeah, and also not worry about what other people are doing. And some nurses can be mean about stuff like, you don't know that, and you don't know, and you went to nursing school and you don't know. And you don't know how to do that.
That does suck.
Didn't I already tell you? Or like I said before, it's like, all right,
girl. Like, it didn't stick. So can you explain again?
Yeah, and just like, not paying attention to that, knowing that you're doing your best. At the end of the day, all you can do is try to keep your patients safe and also yourself safe from like being anxious all the time.
Yeah.
Because be anxious all the time and
it's
stress all the time, you're gonna break out like me. Like I do all the time.
And you might get hyperthyroidism like me. So
we're living the truths that we're telling you.
So overall, in reflecting on how I was before, I definitely have imposter syndrome. And it's not that I'm over it or anything like that, but I do try my best to try to not be so anxious and come out of my comfort zone and ask those questions, even if I don't know. Not telling myself like, oh, you're a phony, like you don't know anything.
Mm-hmm.
Girl, you know.
Yeah.
You know. Yeah. And if you don't know, ask the question.
Now you're gonna know.
And clarify yourself. Like, what do I know about this? Why do you say I don't know? Yeah. You know what I mean?
Yeah,
so
exactly.
That's me. I think I have imposter syndrome.
Yeah, I mean, I think that there has been moments in my career where I felt that imposter syndrome. Mm-hmm. I don't feel like I feel it often, like I feel it every day of my career, no. Mm-hmm. Moments of it I have, like during the RRT or moments when I first started. And I think that the ways I got over it is just being patient with myself. I think sometimes I can also be hard on myself to try to learn something quick. Like, I'm like, yo, I shouldn't need you to teach me more than once. If you show me once, I'm going to get it. Mm-hmm. And then if I don't get it, I'm like, wow,
I'm
dumb. Stupid.
I didn't know. What?
Why didn't you get it? Like, come
You're
on.
a nurse. Like, how didn't you get that?
Come on. Like, how did you? So I just felt like I had to be more patient with myself, not as hard on myself, and just pretty much figure out the root of what I need to do to learn and
not feel that way. Yep. Yeah, that's exactly what it is. So let us know in the comments down below if you feel that you have imposter syndrome. It doesn't have to necessarily be in nursing, but life in general, right? Yeah. So let us know. Please do not forget to subscribe to our channel and help your favorite nurses out.
Yes.
You feel me?
Subscribe, comment, like, and let us know so that we can continue to make more content. And also, why is it called imposter syndrome? I don't know.
Like weird, you're imposter. Like you don't belong. Like you're faking it.
Oh, okay. Mm-hmm. All right. I was gonna ask you guys, but Natalie got it.
Oh.
So she got it, so we good.
Okay, but then again, you guys let us know too. What do you guys think?
No, I was just confused. Like, why is it called imposter syndrome? But now I know. All right, let us know what you guys think, and we'll see you next time.
Bye, guys.